Welcome to Forbes Middle East. I'm Sally Musa and we are here at the Accessibility Expo 2023 and we are delighted to be joined by Dr. Omar Almodayfer, the chairman of the Human Development Company, to talk all of the latest in special education and disability care. Welcome, Dr. Omar. It's great to have you with us.
Thank you.
Now, Dr. Omar, of course, HDC is a true pioneer in the area of special education and care. So talk to us about the journey. How challenging has it been as founder and how rewarding it must be to see HDC come so far?
The HDC started, which is interesting to be able to know, started as a non-profit organization. So we couldn't continue. So we decided to mix business and charity together. So we ended up having it commercial purely, but funding a certain number of children who needs the service, who cannot afford it or who doesn't get the right funds. The challenges are always related to how to govern such service. The disability sector, one of its weaknesses is that it's not outcome driven. And I come from a medical background. I'm a child psychiatrist by profession. So outcome for us is a big thing. In disability, the outcome to be the focus is not always easy because depending on the severity of the disability, the outcome becomes variable. So the more the disability you have, the less good outcome you will have. So the outcome will be kind of downgraded. Rather than functioning in an environment outside the home, you'll be functioning at home. Self-care becomes the focus rather than having a job. So it's just that dance between cases. So what we had is we have to cater for a large number of disabled. That was what our plan in the beginning. And you cannot do that with a pencil and paper. And you can't do that depending on your professionals, because you cannot have enough professionals to serve the disability sector. This is a fact, because disability is getting more and the skills required are getting more. So we ended up having some sort of a mainstream pathway that we can put the disabled on it. Let's say autism cases will have that pathway, mentally challenged people will have that pathway. And that pathway is based on their deficits and capacities, their strengths and weaknesses. It's based on scientific perspective, but it was structured. And eventually we're able to software this. In a software which is, I think it's very unique because it automates the services of the disability sector, and in another sense it's governed it very well. So the payers, the government, the parents are able to see what's happening. The second challenge was funding a budget, and governments have been helping in this, and recently the Gulf has moved into funding the disability sector more and more and outsourcing it to the private sector. In Saudi Arabia, King Salman and Prince Mohammed, they had the vision of 2030, which had a big part of it is about quality of life, and part of that is for disabled. So the disability sector became more dynamic with this vision, and it's serving the people more and more.
So let's talk a little bit about that, about the impact that you have had, in fact, on Saudi Arabia and the wider GCC as well, and the value that you continue to bring to both individuals and communities across the region.
Today in Saudi Arabia, we have 40 projects around the kingdom, which is a big number for disability. We have 5,000 plus kids enrolled in it on a daily basis. We're not talking about sessions. With the infrastructure we developed, we're able to spread, scale good services across the kingdom. And that's a challenge in the disability sector always, is how to scale up the service with a reasonable, I wouldn't say perfect, because there's nothing perfect, with a reasonable quality of care, which is monitored, followed up, and governed very well. The impact we had is we proved that the disability sector can be served in a structured, governed way rather than being dependent on individuals. So it can be system-based rather than specialist-based. which is totally different, and it's a big achievement because with this you can improve the service and you can spread it. Today we can open a disability care center within 3 to 6 months because we have all the infrastructure is ready, which is the challenging point. The second thing also we brought into the market is you can have a cost-effective rehabilitation service because rehabilitation is always seen as you need a lot of budget. You can't see the results. Everybody asking for higher budget. We were able to prove this with reasonable governance that we bring reasonable quality with a reasonable cost. So that's made it easier for the government to fund it and to move on with it. And that's important for the sector because you can have a 5-star service somewhere, but you cannot scale it up. Nobody will be able to afford it, either individuals or insurance or government.
And so, to that point, the impact is huge, but what more can be done in terms of raising awareness as well as increasing the social responsibility around disability care?
Everybody's working on the awareness. Governments are working, medical care people are working, education is working. The interesting part is that you find different cultures have different perception. Some of the cultures are very open about the disability and they work very hard for it to the extent that they give up their life, which is worrisome for us because you have to keep the family running in addition to caring for the child, and that's one of the missions of HDC, that we will take care of your child and just continue living as normal. Second group of people will be worried about the stigma. So if you have a child who have disability, they are stigmatizing. This is becoming less, to be fair. There is a third group which people doesn't know about it, which is not a small percentage. People who lost hope, and they don't think it's worth it. So let's just move on living and keep this child isolated or whatever, or taken care of by different means. Still, you have sub-segments which are not served. So 0 to 3 are not very well served. From birth till the age of 3, that's not well served. Residential care is not well developed in the region. Although we are a family-based society, so disabled people still stays with their families. But subgroup of them we need some modeling. We need respite care, we call it. So people that are traveling, they can put their child somewhere. We need a longer time service, so you can have a full day 8 to 8 program, so the family strain become less. We need that modeling with the governments to work close by, and we are in discussions. The government has seen that the sector has improved itself, so they are opening up more opportunities in the principle of outsourcing and cost control.
So many different parts of the ecosystem that we really need to work on, and we look forward to seeing HDC part of that. Dr. Omar Almodayfer, Chairman of the Human Development Company, thank you so much for joining us.
Thank you for coming, and thanks for the audience.